In defence estimates earlier this year, we had some discussion around the mental health and wellbeing strategy and program that Defence were running, and they have moved the clinical services into the personnel branch with a focus on wellbeing. As you develop this strategy, can you inform the committee what focus DVA has on this balance between a focus on clinical services versus the broader wellbeing aspect of it?
Senator, I'm certainly happy to hand to my colleagues, but I wanted to open by saying that one of the key improvements DVA has implemented over the last 6 months, in line with your point about clinical governance and support and for broader wellbeing measures, is to appoint an acting chief psychiatrist who is providing clinical support across the whole department, including across wellbeing programs, and able to provide military-aware advice. As a former veteran himself, he is integrally involved in clinical oversight of any work in the department that occurs in that space, which is obviously extensive given Open Arms and some other clinical support services that we provide, but also to provide that clinical lens to broader wellbeing programs as well. So that is something we've put in place that will continue to be drawn on in line with what you're talking about, the link between clinical oversight and our general practice on wellbeing. Is there anything?
The key area that I'm going to is in terms of capacity for service provision in a timely manner, because one of the concerns for both serving members and veterans in the past has been the requirement when an acute event occurs, often to utilise the existing civilian infrastructure at a state-funded hospital, which has been found to be inadequate. So I'm interested to understand where your strategy is going in terms of the relative focus if we're having a combined mental health and wellbeing program, and particularly in the light of the research paper, the April 24 research paper that was produced as part of the Royal Commission. Are you familiar with that one?
Sorry, could you refer to that paper again?
This is Understanding Enhancing Responses to Suicide Crises Involving Current Serving and Ex-Serving Members of the ADF, a data linkage survey, Royal Commission title on it in April 2024.
Is that the one by Professor Heffernan in Brisbane?
I don't have the...
It's all the first response.
I don't have the
We've
author...
certainly seen all the reports, Senator. I just need to...
Sure, but my point is, on page 28, they highlight that just looking at Queensland as a subset of the data, that Table 2 highlights that police or paramedics in Queensland will engage with at least one new veteran, not people who are coming back, but one new veteran in suicide crisis every 16 hours. And what that says to me is that the narrative that the committee has heard from Defence and Veterans Affairs in the past, that the caseload doesn't justify the re-establishment of services equivalent to or analogous to the old repatriation hospitals, where there is a dedicated service to support serving and ex-service members, as opposed to picking back onto broader community services. The allegation is the caseload is not there. This is an alarming figure. If one new veteran every 16 hours connects with paramedics or police in Queensland, then nationally that figure would even be denser. So I'm interested to understand, where is your focus for this strategy in terms of the provision of clinical services? Because clearly, according to this report, the need is acute.
Senator, we're continuing to... there are some facilities that exist, as you would be aware, that are for veterans specifically, and we obviously monitor the availability in those services and do whatever we can to refer veterans and ensure their admission to those services where they're available. I did also want to mention that, and we can provide you some more information on this. I am aware of that report, and we have some work underway with the Australian Federal Police where we are looking to better equip their officers, and this is as a precursor to improving this training and support more broadly on veteran issues and to be more military aware in responding to crisis calls. So we are looking to develop some training and equip AFP officers better around veteran issues and specifically being aware of those numbers and the need to ensure that there is awareness of veteran-specific issues to consider in response to a crisis. And then, as you say, there's also the consideration of what facilities are available that are veteran aware as well. And as I said, there are facilities available. And we have a list of those facilities and which ones are available, you know, what the capacity is in each of those facilities. And we continue to work closely with the sector about what more might be needed. There are specific recommendations in the Royal Commission about improving knowledge of veteran issues in the healthcare workforce. And we, as I said, are working on some responses and what might be able to be done in response to those recommendations. We already have training programs that we've developed in the last 12 months to better equip GPs around veteran issues, and that is part of their continuing professional development. Those programs are certified and part of their CPD. So there are a range of initiatives underway, Senator, but if you would like more information about the facilities, the acute clinical facilities, I think that's what you're specifically asking about.
My question is around the strategy and the focus, the relative focus you're putting on the provision of clinical services for acute incidents, because if that strategy is going to inform future investment for both DVA and Defence in these areas, then the practice we have had in the past is demonstrably not suitable given this kind of caseload. And so I'm not asking about this current status, I'm asking about where your focus is on the strategy, because that will set the investment priorities moving forward. So I'm wanting to know what is the relative focus of clinical services versus broader wellbeing in the work you're doing on the strategy that Senator Davey was asking about?
I don't think we have a clear response, Senator, in terms of both are important. Both are the focus of our work and efforts. As I've outlined, there's a range of work that is underway. I'm not saying these are things we're going to do. I'm saying these are things we are doing. So I don't have a direct response in terms of the relative importance. They are both the subject of continued improvement and reform under the mental health and wellbeing strategy, as they are under a range of improvement efforts in DVAs. So I think that's as much as I am able to provide in response to the question, Senator.
Sure. My only concluding comment would be that as I spoke to Defence, and I'm assuming you are working collaboratively with them.
That's correct.
Their approach has been to make the clinical a subset of personnel branch, which I find a wholly inadequate approach to dealing with what is a critical life-saving intervention that is required for veterans who are having an acute episode. The focus there needs to be on a clinical intervention, not on a broader personnel-based, how do we make people more resilient? It's important, but what that says to me is there's a relative priority which is actually diminishing the command and control and investment focus on the clinical. So if you're working with Defence, my concern is that that will be the direction you are being taken. I'm happy to leave it there, but we will come back once that strategy is released.
Can I just make one point, Senator, in response? As I've said, our focus is on both, and there is always a recognition that the broader focus on wellbeing, and you mentioned resilience, other ranges of support measures, are part of early intervention and prevention approaches that seek in the medium to long term to reduce the acute clinical need that you referred to as well, Senator. So both are needed, and they both are the focus of our ongoing efforts in DVA.
I'll await the delivery of the strategy with great interest. Thank you.
Thank you.